Deb, thanks so much for sitting down and taking your time to explain your experience. So what got you started? What were your health challenges that led you here?
So I had extreme pain in my knees and
Both of them?
both knees, yeah. And pain in my toes and pain in one of my thumbs still, even after I had surgery.
Wow.
So-
What was causing all this?
Arthritis,
What was it, rheumatoid or was
No.
it osteoarthritis?
osteo.
But in all these different places.
Yeah,
Wow.
I've had it in many places in my body. When I had shoulder surgery, they scraped off some off my collarbone.
Wow.
So I got it really early on in age 30.
Wow.
So, yeah.
And then for how many years were you struggling with it?
Oh, quite a few years, yeah. And I was at the point where I was going to have to decide, am I going to go in and have knee replacement or what am I going to do? And I had stem cell surgery on my left thumb, and it was very successful, and that was in 2014.
So when you say stem cell surgery, what does that mean? Like, what did they do?
So they went in and they shaved the bone, and then they injected the cord blood and closed it up, and I went on my merry way, and within 2 months I was completely done.
Wow.
No pain at all, and full range of mobility. It was wonderful.
Wow.
Yeah.
And then, subsequent to that, with your knees, you were feeling like surgery was going to be in
That
your
was
future.
going to be my option, yeah.
Wow.
And I was looking for an alternative to surgery. I have grandkids, and I like to be on the ground with them, playing with them. So I just didn't want to have to go through all the pain and recovery and PT if I could avoid it.
Right. So how long ago was it that you decided to get the cell therapy for your knees?
It was last spring, and
So not
I
quite
went
a year.
to not quite a year. I went to a seminar and decided that I would come into the office and at least talk to the doctors and see what they thought they could do for me. And they were pretty excited because they thought that with my thumb surgery and having some success with that I probably would respond well.
So you went out and got this information. I guess you said it was a seminar you went to, and they were talking about what the possibilities were for this
Right.
type of therapy or treatment.
Right.
And from that, you said, okay, you're going to go ahead and give this a shot. Did you do both knees at the same time, one at a time?
No, I did both knees at the
Wow,
same
you just
time.
went all in.
I did. I went all in, and I did the intravenous as well.
Okay, so you did
Yeah,
that.
because I also had pain in my toes, and then this thumb that had an older type surgery, no stem cells in it, and so I don't have any pain in my toes anymore at all.
Wow.
And my knees are great.
When you say great, what do you mean?
I mean, like, I don't have pain in my knees, and I can go up and down hills. I can be on the ground with my grandkids, chasing them around.
So, sorry, because it's like you went from 0 to 100 like this, right? So
No, it took months for that to happen.
Okay.
Yeah.
And what were you expecting? Like, what would you have considered success from
Success
this
would have been probably, maybe a pain level of between, maybe up to 4, would have been, because at that point, at 4, I probably would have to start intervening with some kind of medications. And my goal is to really not have to take medications
Yeah.
or pain meds for pain.
Right.
So,
And if you're saying your goal was maybe to get to a 4, what was it before you had the treatment?
I was at an 8
You were way up
when
there.
I came in, yeah.
And
I was
now it's a 0? Is it literally like 0?
0, like literally 0. I wake up in the morning and it's wonderful. I don't have any pain waking me up going, oh my gosh.
So then beyond your expectations.
It was beyond my expectations.
And you said, so sort of systemically, because if I'm interpreting you correctly, you had direct injections into your knees.
Correct.
But then you did intravenous and had it go through your entire body. And you
Right.
found that your toes and that thumb that you said you had a surgery on, how's that?
This one still has a little bit of recurring pain now and then, but it's better than it was. And like I said, nothing at all in my toes, which is great because when you're walking,
Yeah.
that can really be a problem.
Wow.
Yeah.
Were your doctors at all surprised? The ones who were treating your knees and toes before you had this stem cell therapy?
I don't think so. I mean, they were surprised that I got that much relief. But I think the doctors I go to, they're a little more progressive,
Yeah.
so they were aware of stem cell therapy and things like that. So
Wow. Well, it certainly sounds like this was a great decision on your part. And I'm very happy for you and wish you,
Thank you.
continue expanding health. But quite remarkable story. So thank you for sharing it.
yeah, no problem.